You should consult your physician or other healthcare professional before starting this or any other fitness program to determine if it is right for your needs. This is particularly true if you or your family have a history of high blood pressure or heart disease, or if you have ever experienced chest pain when exercising, or have experienced chest pain in the past month when not engaged in physical activity, smoke, have high cholesterol, are obese, or have joint problems that could be made worse by a change in physical activity. If you experience faintness, dizziness, pain, or shortness of breath at any time while exercising, you should stop immediately. Stop immediately if anything causes you pain.
If you experience any pain or discomfort, you should stop exercising immediately. If you have trouble balancing, be sure to use an assistive device or have someone nearby to reduce the risk of falling. If you are an inactive individual, start at a comfortable pace and take multiple rest breaks.
So the first thing we're going to do are some abdominal contractions. So we're just going to work the muscles in our belly a little bit. So you're going to take your hands, you're going to feel for that bony part in your hips on either side, and you're just going to put your hands right on the inside of those. And you're going to contract those muscles right there, and you'll feel in your fingers if you're working them right. So we're just going to hold that for about 10 seconds, and you should be breathing while you're doing this. Talking to somebody in the room, make sure you're doing it right. Okay, and then relax. And you'll do that 2 more times. So you'll hold and relax for another 10 seconds. And then hold again for another 10 seconds and relax. And make sure you take breaks as needed. All right, so the next thing we're gonna do are pelvic tilts. So if you can imagine your hips being like a soup bowl, you're just gonna tip the bowl forward and you're gonna tip the bowl backwards. So you can put your hands on your hips to kind of feel where your hips are moving. So first you're gonna sit up straight and then you're gonna tip the bowl forward and you'll hold that for 5 seconds. So 1, 2, 3, 4, 5, and then you'll come back to neutral. And then you go backwards for 5. 1, 2, 3, 4, 5, and then you'll go back to neutral. We'll do it 2 more times. We go forward for 5-second hold, come back to neutral, backwards, 5-second hold, come back to neutral. And then 1 more time we'll do forward, 5-second hold, and neutral. Backwards, 5-second hold, and neutral. So next we're going to do marches. So you're just going to be sitting, and then we can still use our hands to feel if our abdominal muscles are working. And then you're just going to lift up your leg and hold it for a second and put it down. And then alternate legs. So hold it for a second and put it down. So 1 and down. 1 second and down. 1 second and put it down. 1 second and put it down. And then we'll do 10 total of those on each side. So next we're going to do trunk tilts. So first you're going to start off sitting nice and tall, and then we're going to go 4 different directions with this. So you're going to lean forward and hold that for 3 seconds. 1, 2, 3, and then you're going to come back to neutral. And we'll go to the left. 1, 2, 3, and then back to neutral. Then you're going to go backwards. 1, 2, 3, and back to straight. And then you'll go to the right. 1, 2, 3, and then back to neutral. Then we'll try it again. We'll go straight for 3 seconds. 3, 2, 1, and back to neutral. To the left. 3, 2, 1. Back to upright. Go backwards. 1, 2, 3, and straight. And then we'll go to the right. 1, 2, 3, and back to neutral. We'll go 1 more time. 1, 2, 3, and you're doing a great job. 1, 2, 3, and backwards. 1, 2, 3. You're almost done. Last one. 1, 2, 3, and straight. Then we'll do that 5 times total.